So this is the opening of the sac that the heart's inside. And it allows us access to the heart. In a minute, we'll go on the heart-lung machine, so the heart's not crucial to the circulation for that period of time, and then actually stop the heart. This is the first step. So once the sac's open, then we inflate that balloon I showed you that we put in the first part of the aorta, so that the circulation to the heart is now under our control and no longer is part of the greater circulatory system. So the tubes in the groin are supporting the blood flow to everything else. The brain, the kidneys, the intestines, the arms, the legs, everything else is being supplied by those tubes in the groin, but we have control of the circulation to the heart itself. So we intentionally give a real cold solution that has a lot of potassium in it, and that causes the heart muscle essentially to go to sleep. It's also what Texas used to use in their death chambers. So now you can see right now that the heart is going to sleep. They didn't have robots there. So you can see now the force of this heart's contraction is decreasing, and it's ultimately going to stop altogether. Now, this particular view is called Tile Pro. That's the brand name. But again, it's what I showed you earlier. This is actually what we're looking at through the robot screen right now. This is the echo that shows the first part of the aorta. This is actually the balloon blown up in the aorta. The solution that's causing the heart to stop is coming out through this little nipple at the end of the balloon. The arteries are right here that go to the heart muscle. So only the heart is getting this special solution that causes it to stop. It also decreases its metabolic demand to about 5% of normal, so the heart muscle's fine, and we feed it every so often while we're doing our work. So you can see the heart's essentially come to a stop now. So once we've accomplished that, then we improve our exposure of the heart with some sutures on that pericardium that we've cut. Once we accomplish that, then we start opening up the wall of one of the cardiac chambers. In this case, it's the right atrium, to start doing the work that needs to be done. You can see the scissors tips there. If you look here, again, I'm sure Dr. Salem showed you this, but this is the working part of these things. These shafts all are straight and inflexible, but there are 7 degrees of motion between the setup of these joints. And that all is a telemanipulation capability via the console. So you're moving your hands, and you learn that by that movement, you move these instruments a certain way. So ultimately, you're doing this, and the scissors are doing this. And so once you learn it and you get facile with it, pretty soon you're just kind of working away like you've been doing it forever like that. This white tube here is one of the tubes that was put in from the neck in this particular case. So our anesthesiologist placed this, and using the echo, he got it right where he wanted it to be. We're just going to leave it alone for this particular case. It helps drain extra blood that accumulates in the heart. So then when we're done doing the work, then we close it up. So you could see that the heart was still there when we were going in to do the work. Now that balloon has been let down, so the warm blood with the normal potassium solution is now bathing the heart muscle again, and the heart starts to wake up. And now that chamber called the atrium is being closed. So I want you to watch this next sequence here. I meant to point it out, but this again is an example of the teamwork that's involved in this case. You can see the 2 robot arms working here, but in just a second you're going to see another instrument dart in from here. This is the bedside assistant who's watching the video monitor and has his or her port there to work with, and they're right on it. They know what the next step is, and they're coming in and either grabbing the needle or they're going to follow. That's what we call it when you pull the suture tight when you're helping somebody else do the sewing. Here it comes right here. So he's coming to grab this needle. That's going to the outside of the body now. And actually the knots to tie this down start from the outside of the body. We call that extracorporeal knot tying. So now we're done with the robot. The heart's providing circulation to the body again, and now we're going to take the robot away. You see they're just pulling it away from the body now, and we're starting to work on closing up things at the end of the case.